Does sleep apnea raise red blood cell count? If you've ever wondered how sleep apnea might affect your blood, you're about to find out some interesting and important information. Let's start with what sleep apnea is. It's a condition where your airway collapses during sleep, causing you to stop breathing for short periods. This can lead to a range of health issues, including changes in your blood. When you have sleep apnea, your body doesn't get enough oxygen. This lack of oxygen, or hypoxia, triggers your body to produce more red blood cells to compensate for the oxygen shortage. Red blood cells are crucial because they carry oxygen to all parts of your body. Studies have shown that the severity of sleep apnea is significantly associated with an increase in hematocrit, which is the percentage of red blood cells in your blood. For example, one study found that patients with severe sleep apnea had higher hematocrit levels compared to those with mild or moderate sleep apnea. Here's how it works. When your body detects low oxygen levels, it responds by producing more red blood cells. This is a natural response to ensure that your tissues get enough oxygen. However, having too many red blood cells can lead to a condition called erythrocytosis, which is associated with increased risks of heart disease, kidney disease, and even stroke. The connection between sleep apnea and red blood cell count is also linked to the apnea-hypopnea index, AHI, which measures the severity of sleep apnea. A higher AHI indicates more severe sleep apnea, and this has been correlated with higher red blood cell distribution width, RDW, and hematocrit levels. Using a continuous positive airway pressure, CPAP, machine can help reduce these elevated red blood cell counts. Studies have shown that patients treated with CPAP experienced significant decreases in hematocrit levels over time. In summary, sleep apnea can indeed raise your red blood cell count as your body tries to compensate for the lack of oxygen. This is why it's important for primary care physicians to consider sleep apnea as a potential cause when they see patients with elevated hematocrit levels. If you're experiencing symptoms like excessive daytime sleepiness or other signs of sleep apnea, it's crucial to get evaluated and treated to prevent long-term health complications.